Hi everyone! Now, I know you're probably wondering why the heck is there a tangerine in this video, and that is because this is the first way that I learned how to remove corns and calluses. This is, of course, before ever practicing on human skin. Now, not everyone is first going to start by practicing on fruit. You might start with an alginate type substance or even a pig's foot, which is, by the way, a great way for practicing suturing, but that's not this video. It's nice to practice on something with a rind, particularly because you can easily see where the layers of flesh change. So when removing a corn or callus, we are also working with layers, but deciphering where to stop is based a lot on feel and experience because it's not always super easy to tell the difference between the layers of the skin. And it's very easy to go too far and cause bleeding. So here I am coming in at a bit more of an angle than I would normally. So for corns, I usually come in more perpendicular to the skin, not quite at a 90-degree angle, but maybe more of like a 70-degree angle. Whereas in this video, I'm at more of a 30-degree angle, but hey, it's not real skin and there's only so much that I can simulate. I'll demonstrate on a real corn in another video. Now you want to lacerate the top layer of the skin and using your technique, scrape it out from the sides. And once the bulk of the lesion is out, then you can start cleaning things up. So this is where the rind is particularly helpful because the rind acts like the epidermis, which is the top layer of the skin, and that's where the corn would reside. The inside of the tangerine would represent the dermis or the subcutaneous layers, which both of which have nerves and blood vessels. So we don't want to go that deep when we are removing a corn or a callus. The reason that we're able to remove a corn or a callus without pain or bleeding is because they are residing in that top layer of the skin, the epidermis, and there's no blood vessels there. So what we want to do after we've removed the bulk is we don't want to forget about the surrounding skin around a corn because you can take out the entire corn, but if you don't smooth out some of the surrounding skin, sometimes that can continue to cause pain. So here what I'm doing is I'm actually digging out some of the inside of the, we'll call it the corn. So this is really scraping that layer. We've gotten the bulk out. Now we're cleaning up all of that extra skin. Of course, if you go too aggressive, you risk causing bleeding, causing more tenderness. But if you go too conservative, then you run the risk of the patient walking out still having pain, or even if they walk out without pain, the corn coming back too quickly, and then they're back in your office a week later saying it's hurting again. Neither of which is very good. So just scraping out that inner skin and trying to make that look nice and clean. Now, a lot of people ask me the difference between a corn and a callus, and just they're both keratin. They're caused by slightly different things, and the structure is slightly different, but they are still made up of the same thing, keratin. So a corn is caused from pressure. So think of like a pressure point versus a callus, which is caused from friction or rubbing. The callus will be diffuse and a little bit more widespread versus the corn, which is almost like a little dense dark spot. The reason why people think a corn has a root, and I disagree with that, is because we're stepping on it, so it gets pushed further into the skin. It's just think of it like a little ball of callus, right? A little ball of callus, and you're stepping on it, so it gets pushed into the skin. It's not a root. It's not quote unquote deep. It's just that it's been pushed into the skin because of our body weight. So here, what I'm doing, again, smoothing the edges so we don't have any sharp, distinct lines. This helps to relieve some of the pressure or the pain. And I've just changed my grip. The grip that I'm using now is the grip that I use when I'm debriding just a callus. So you have a pencil grip when you're cutting out the corn, when you're digging it out, and you change to this grip where your scalpel is almost perpendicular to the skin and you're just kind of shaving. So this would be more for callus. But since I'm taking the edges of the corn, I'm taking the callus surrounding the corn, that's why I'm doing it this way. So just continuing on until it's nice and smooth, and that will really help to create the best outcome for the patient. And keep in mind that it does take some time to get good at this process, right? We first practice on a fruit, then we might move to practice on one another, so our fellow students, and then we move to a practice clinic where all of the patients coming in know that they are being treated by students. So you work your way up to paying patients, basically. So I sped the video up a little bit. I wanted to show you this process here. I would not make a corn opening this big, but just for demonstrative purposes, I wanted to show you what I'm doing here. I'm making the edges very, very thin, very fine, so it's a really nice transition from the opening in the skin to the healthier skin. Now, this actually works very well, this kind of technique, for debriding a foot ulcer. So when someone has, for example, a diabetic foot ulcer, a big opening in the skin, you want to really pare down those edges so that it helps promote wound healing. So I've kind of cleaned everything up, made everything nice and smooth, and here is our finished product. I think it looks pretty good. Ready to eat. That was gross. Sorry, guys. But yeah, nice and smooth. All right. Well, I'll see you in the next video. Bye.